Good afternoon and welcome to Newark Beth Israel Medical Center and Children's Hospital of New Jersey's Black History Month celebration. We are very proud to continue the tradition that was started by Alma Beatty here at Newark Beth Israel, celebrating the accomplishments of our Black heroes. This year, I wanted to just say a special thank you to all the hospital employees. We have gone through it this year, and many times we've heard the term heroes, but you truly are heroes at Newark Beth Israel and throughout healthcare during this very difficult year that we have had. I want to thank Dr. Rodgers. We're in for a treat today. She is truly special and a gem, someone I'm proud to call friend and certainly colleague. Ever since George Floyd was murdered, there was a lot of media attention focused on the Black condition here in the United States. And then it fell off the front pages of the paper. You're not seeing it in paper. You're not seeing it on the news anymore. It's, they're focusing in on lies and deception and other things that really don't matter to Black lives. And I'm here to tell you that at Newark Beth Israel Medical Center, as long as I'm the president here, we will continue to look at these issues of equity. We will continue to fight disparities. And I'm really proud to say that our system, RWJBarnabas Health, is committed to ending racism together. There's a board committee, there's a steering committee led by our president and CEO, Barry Ostrowski, and we are committed. We have constant meetings to figure out how we can do better in every category. And I am proud to work for a system that's interested and committed to changing the plight of our Black brothers and sisters. So enough for me. I just wanted to say hello to everyone, and then I'm going to turn it over to our Director of Diversity, Atiya Rashidi. Thank you, Atiya.
Good afternoon, everyone. So glad that you can join us. Again, I am Atiya Rashidi, Director of Diversity and Inclusion here at Newark Beth Israel Medical Center and Children's Hospital of New Jersey. I'm so very excited to have our President and CEO, Mr. Darrell K. Terry Sr., join us this morning and bring you those words of welcome to our annual Black History Month program that we have here at Newark Beth Israel Medical Center. We have been hosting these celebrations for nearly 30 years, and this is our first virtual event. There are more than 140 people registered for today's webinar, which is really exciting. Hosting this event virtually means that we can now reach more people from a greater Newark Beth Israel community, not just our employees, but also our friends, families, and neighbors. As Mr. Terry said, 2020 was an unprecedented year filled with defining moments for our world, our nation, and the African American community in particular. So it brings us great pleasure to bring this ceremony to you virtually. This afternoon, our keynote speaker is Dr. Denise Rodgers, Vice Chancellor for Interprofessional Programs at Rutgers Biomedical and Health Sciences. Dr. Rodgers has spent much of her career working with marginalized, minority, and disadvantaged patients and communities. She currently chairs the steering committee for the Believe in a Healthy Newark Culture of Health initiative that was funded by the Robert Wood Johnson Foundation of New Jersey. It is these initiatives that brings her here with us today. She is a member of our Greater Newark Community Advisory Board, and I would like to thank Dr. Rodgers for being with us here today in celebration of our Black History Month. Welcome, Dr. Rodgers.
Thank you, and good afternoon. I want to begin by thanking Mr. Darrell Terry, Dr. Marilyn Harris, and Ms. Atiya Rashidi for inviting me to deliver today's keynote address. Since we're commemorating Black History Month, I want to start by quoting Dr. Martin Luther King's famous speech delivered in front of the Lincoln Memorial on August 28, 1963. We most often hear the portion of that speech where he talks about his dream that his 4 little children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character. However, that is not the section I choose to quote today. Today, I want to remind us that during that remarkable speech, Dr. King also said, quote, "When the architects of our republic wrote the magnificent words of the Constitution and the Declaration of Independence, they were signing a promissory note to which every American was to fall heir. This note was a promise that all men, yes, Black men as well as white men, would be guaranteed the unalienable rights of life, liberty, and the pursuit of happiness. It is obvious today that America has defaulted on this promissory note insofar as her citizens of color are concerned. Instead of honoring this sacred obligation, America has given the Negro people a bad check, a check which has come back marked insufficient funds. But we refuse to believe that the Bank of Justice is bankrupt. We refuse to believe that there are insufficient funds in the great vaults of opportunity of this nation. And so we've come to cash this check, a check that will give us upon demand the riches of freedom and the security of justice. We have also come to this hallowed spot to remind America of the fierce urgency of now. This is no time to engage in the luxury of cooling off or taking the tranquilizing drug of gradualism. It would be fatal for this nation to overlook the urgency of the moment. This sweltering summer of the Negro's legitimate discontent will not pass until there is an invigorating autumn of freedom and equality. 1963 is not an end, but a beginning. Those who hope that the Negro needed to blow off steam and will now be content will have a rude awakening if the nation returns to business as usual. There will be neither rest nor tranquility in America until the Negro is granted his citizenship rights. The whirlwinds of revolt will continue to shake the foundations of our nation until the bright days of justice emerges." King goes on to say, quote, "We must forever conduct our struggle on the high plane of dignity and discipline. We must not allow our creative protests to degenerate into physical violence. Again and again, we must rise to the majestic heights of meeting physical force with soul force. The marvelous new militancy which has engulfed the Negro community must not lead us to a distrust of all white people, for many of our white brothers, as evidenced by their presence here today, have come to realize that their destiny is tied up with our destiny. And they have come to realize that their freedom is inextricably bound to our freedom. We cannot walk alone. And as we walk, we must mark the pledge that we shall always march ahead. We cannot turn back." There are those who are asking the devotees of civil rights, when will you be satisfied? We can never be satisfied as long as the Negro is the victim of the unspeakable horrors of police brutality. We cannot be satisfied as long as a Negro in Mississippi cannot vote and a Negro in New York believes he has nothing for which to vote. No, we are not satisfied, and we will not be satisfied until justice rolls down like waters and righteousness like a mighty stream. It is hard to believe how prophetic Dr. King was during that momentous speech. I will remind you, King said, we can never be satisfied as long as the Negro is the victim of unspeakable horrors of police brutality. As you hear those words, how can we not help but think of George Floyd, Breonna Taylor, Tatiana Jefferson, Stephon Clark, Botham Jean, Philando Castile, and so many of the innocent Black people unjustly murdered by the police in recent years. In a study published in the Journal of Epidemiology and Public Health in October 2020, the researchers found that unarmed Blacks were 3 times more likely to be killed by the police when compared to whites, and unarmed Hispanics were nearly 1.5 times more likely to be killed by the police when compared to whites. The public lynching of George Floyd in Minneapolis on May 25, 2020, led to an outpouring of Black Lives Matter demonstrations throughout the United States for much of last spring, summer, and fall. Again, King reminded us that The marvelous new militancy which has engulfed the Negro community must not lead us to a distrust of all white people. For many of our white brothers, as evidenced by their presence here today, have come to realize that their destiny is tied up with our destiny, end quote. Again, prophetic words, as it is estimated that between 15 and 26 million Americans engaged in one or more Black Lives Matter protests in 2020. On June 6th alone, 500,000 people turned out to demonstrate in over 550 places across the United States. The vast majority of these protests were filled with an extremely diverse group of protesters. Nearly 40% of all counties in the United States had at least one protest. Nearly 95% of counties that had protests are majority white. This data is based on reporting from the New York Times from July of last year in an article entitled, "Black Lives Matter May Be the Largest Movement in US History." And again, returning to the words of Dr. King, we must forever conduct our struggle on the high plane of dignity and discipline. We must not allow our creative protests to degenerate into physical violence. Again and again, we must rise to the majestic heights of meeting physical force with soul force. Despite what some in the media would have us believe, over 90% of all Black Lives Matter protests were held peacefully. And as we know from the events of June 1st, 2020, when peaceful protesters were tear gassed to clear a way for the then president to take a picture in front of a church, some of the violence that occurred was perpetrated by the police. In order to put Black Lives Matter movement into perspective, I want to quote the Unitarian minister, Reverend Nancy McDonald Ladd, who said, quote, "When we say save the rainforest, we don't mean that we cease to honor the mighty cedars or the reaching pines. We mean that one particular piece of a deeply sacred whole is more at risk than others, and that this risk, this threat, is worthy of our very bravest actions. So it is with Black lives in this country, and the message that Black Lives Matter is important so long as this nation effectively functions as if they do not." As a family physician, it is of course imperative that I also note that Black health matters as part of the larger movement to value Black lives. In the state of New Jersey today, from the day a Black infant is born to the day that Black adult dies, we see disparities in health outcomes. Black infants are 2.5 to 3 times more likely to die in the first year of life compared to their white counterparts. Black children of all ages are more likely to die in comparison to their white counterparts. The life expectancy for Blacks in New Jersey is the lowest when compared to whites, Asians, and Hispanics in this state. African Americans live on average 3 years less than their white counterparts and nearly 16 years less than their Asian counterparts. Blacks in New Jersey are more likely to die from heart disease, cancer, HIV, asthma, homicide, and diabetes when compared to whites. And as most of you are aware, COVID also disproportionately affects Black and brown people in the state. The age-adjusted death rate from COVID in Blacks and Hispanics in New Jersey is more than double the age-adjusted death rate from COVID in whites. Additionally, of the nearly 1.3 million vaccines administered in the state, only 4% have been administered to African Americans, compared to 51% being administered to whites. Latinos have only received 5% of the vaccines. For those of us working in healthcare, eliminating these disparities must be one of our most important priorities as we seek to create a beloved community in Newark and throughout the state where it is clear that Black lives and Black health matter. And before I close, I want to remind us that on that hot August day in Washington in 1963, Dr. King also said, quote, "We cannot be satisfied as long as a Negro in Mississippi cannot vote and a Negro in New Jersey believes he has nothing for which to vote." In November 2020, over 155 million people voted. This is the largest number of votes ever cast since the beginning of the 20th century. 2/3 of every eligible person in this country voted. Over 100 million people voted early, either by mail or in person. As a result, the first woman and the first woman of color was named Vice President of the United States. Kamala Harris, the former senator from California and a woman of Jamaican and Indian descent, has finally broken the vice presidential glass ceiling for both women and minorities. Of course, we have learned from the election of Barack Obama as president that her election does not signal that we have entered some post-racial society. In fact, quoting from a report published by the Brennan Center for Justice, we see that, quote, in a backlash to historic voter turnout in the 2020 general election, and grounded in a rash of baseless and racist allegations of voter fraud and election irregularities, legislators have introduced 3 times the number of bills to restrict voting access as compared to this time last year. 28 states have introduced, pre-filed, or carried over 106 restrictive bills this year, as compared to 35 such bills in 15 states last year. According to the Brennan Center report, Pennsylvania leads the nation in proposed voter suppression legislation in 2021, followed by New Hampshire, Missouri, Mississippi, Texas, and New Jersey. 8 voter suppression bills have been proposed here in New Jersey. Clearly, it is incumbent on all of us to make sure we never go back to the days when eligible voters are preventing from voting through inappropriate voter suppression. If people want to prevent us from voting, it must mean that our votes do indeed mean something. Dr. King said, no, we are not satisfied and we will not be satisfied until justice rolls down like waters and righteousness like a mighty stream. A critically important step in achieving justice is to make sure we all exercise our hard-won right to vote. And we must vote in every election, not just presidential elections. In fact, it may be even more important that we are engaged in selecting members of the school board, local mayors, our New Jersey legislators, and of course, we must engage in selecting the governor. I am asking each of you listening to me today to commit yourselves to voting in every election for which you are eligible from this day forward. People gave their lives so that Black people could get the right to vote. We must not ever allow them to have made that ultimate sacrifice in vain. I will end by saying that I too have a dream. My dream is that 50 years from now, no one will be able to give a speech reflecting on the continued relevancy of Dr. King's 1963 speech. I dream that 50 years from now, we all will be judged by the content of our characters and not the color of our skin. I dream that police brutality will be something we have to study in history books because it is no longer tolerated. In my dream, there are no disparities in health outcomes by race, ethnicity, or income. I dream that everyone will earn a living wage, everyone will live in decent housing, everyone will have access to quality education, and no one will ever go hungry again. And of course, in my dream, political discourse will always remain civil, and everyone will always vote because everyone will have something to vote for. My new shero, Amanda Gorman, said on January 20th, quote, "There is always light, if only we're brave enough to see it, if only we're brave enough to be it." May we all leave this virtual gathering today committing ourselves to be brave enough to be that light. Thank you.
Thank you so much, Dr. Rodgers, for those inspiring words and reminding us about the light, reminded us that we cannot be satisfied. And I want to say in working here at Newark Beth Medical Center and Children's Hospital of New Jersey with Darrell K. Terry Sr. as our president, we will not be satisfied until we are effectively eliminating the disparities that you spoke of. So I thank you again for such an inspiring talk, a much needed talk that we needed to hear today. I want to thank everyone here for joining us today and let you know that this is just one of the many events that we are hosting for Black History Month here at Newark Beth Medical Center. As the Director of Diversity and Inclusion at Newark Beth Medical Center, I've been working very closely with our Social Justice Business Resource Group to develop a Black History Black History Spirit Week. And in this Spirit Week, we are encouraging our employees to participate. On Monday, next week, we have Stomp the Yard. What is that about? We are asking people to wear HBCU apparel or their fraternity or sorority apparel to represent the historical education here in the history of Black history. Also on Wednesday, African attire, understanding that we are from the diaspora and we get to celebrate in that space. And then Blackout Friday, we're asking everybody just to represent in solidarity that Black Lives Matter and wear all Black to work. And so with that, with this, we're going to end our program, and we want you to be able to participate in all of the things that we put out at Newark Beth Medical Center to engage our community and engage our employees and visitors. So with that, that is the end of our Black History Month celebration. And thank you again, Dr. Rodgers.